Hello and welcome to this supplemental video. The purpose of this video is to provide you with a spoken version of my therapy program and universal treatment plan. This is the first video in a series of videos that will outline the process of getting started in therapy. You are in charge of your therapy treatment plan. Think about this treatment plan as an action plan with steps that you and I will take together to achieve your goals for therapy. Your action plan can be as structured or as open as you want it to be. If the media you're listening to becomes overwhelming, if you don't understand the information, if you have any questions, comments, or concerns, or if you would rather not take part in the process of creating a treatment plan, you're allowed to provide me with your verbal consent to follow the program and keep you updated on the progress. I want to respect your preferences, mental capacity, education level, executive functioning, and intellectual abilities. I want to allow for any difficulties you might have in reading, watching videos, or listening to media. If you would like to participate in your treatment planning, please continue listening. The document that this video covers is flagged in the Therapy Portal software library as always available, which means any client with a portal account may open the document to review it, complete it, revise an older version, and sign it once it is completed. I may send it to you as part of the intake process, and every year you're working with me as part of my compliance practices and policies. You can also request a signed copy of the document in PDF. This process of creating your therapy treatment plan is a practice required of mental health clinicians. Beginning November 1st, 2024, and before January 1st, 2025. For me to remain in compliance with health insurance companies and mental health care industry regulations and policies. Every existing client working with me in therapy will be required to review, complete, and sign their treatment plan and this therapy program every year as part of their therapy agreement and informed consent to services. The process of creating the plan will take a while to complete. If you need to break it up over several days or weeks, that is acceptable to the clinician. Laws, insurance policies, and regulations allow the treatment plan to take up to 30 days in some cases. The therapy program's electronic form is also available in a hard copy format. The hard copy format is available as a binder that also includes the notice of privacy practices, several supporting articles, the therapy agreement, and informed consent to therapy services. The therapy program and treatment plan is subject to change, with notice given when extensive revisions are made. As new research is published or new findings emerge in clinical settings, I will revise the supplemental videos in the document to reflect the changes. I will notify clients in sessions as the changes are made, which will also be reflected in the client's therapy notes software-generated treatment plan. My Universal Therapy Program, also known as the treatment plan, is an agreement between you, the client, and me, your counselor or therapist, the clinician. I have asked you to read and sign a therapy program outline and treatment planning document so I can remain in compliance with the laws that govern my profession. As a new client, you must sign your treatment plan no later than 30 days after the first session. You'll be asked to sign the form and complete the associated paperwork every year you and I are still working together. If you have been discharged and later resumed sessions and more than 90 days have passed, you will be asked to complete the paperwork again. Failure to sign the form or at least acknowledge and accept the plan verbally may result in the inability to schedule new sessions. If you continue to attend sessions without signing this form, your attendance indicates agreement with these terms and will constitute your verbal consent. You may also choose to verbally authorize the signing of this document, and that verbal authorization will act as your signed informed consent. This document is supportive of the consent to services and therapy agreement documents that are also required by regulations, laws, and policies. The therapy agreement will include the following information and agreements: the process of therapy and the counselor's approach to therapy. Public health information regarding COVID-19 and protection from infectious diseases. The counselor's professional public disclosure statement, which includes education, credentials, training, and work experience. The Vermont Secretary of State's information regarding unprofessional conduct and how to file a complaint with the Office of Professional Regulation. The HIPAA Notice of Privacy Practice and requirements for storing and sharing medical records and protected health information. A confidentiality agreement and statement of the limits of confidentiality, including the exceptions. A notice of your rights to a good faith estimate guaranteed by the No Surprises Act. Consent to send and receive electronic communication via phone and internet, including SMS texts, apps, client account portals, emails, and website portals. Consent for and information regarding telehealthcare via video conference and phone or audio. And consent for and information regarding audio recording and sessions to allow an AI program to write the clinician's progress notes and other clinical documentation. Allow me to explain why I'm asking you to watch this video about my therapy program and review the document titled Therapy Program and Universal Treatment Plan. The following agencies, boards, and organizations all have specific laws, rules, regulations, procedures, and policies I must adhere to. Vermont Secretary of State and Legislative Statutes. Vermont Office of Professional Regulation. Vermont Board of Allied Mental Health Professionals. United States Center for Medicare and Medicaid Services. United States Department of Health and Human Services. Substance Abuse and Mental Health Services Administration. Vermont Licensed Commercial Health Insurance Companies. National Board of Certified Counselors. American Counseling Association. American Mental Health Counselors Association. American Psychological Association, and the American Psychiatric Association. Please listen carefully to the following information about the electronic form therapy program. Please read the document thoroughly. Please read each section carefully and write down any questions you might have. Once you have reviewed the entire document, check the acknowledgement at the bottom. Sign the document, and the clinician will also sign. Complete the addendums to this document in order. In each addendum, complete the assignments, watch the videos, and practice what you learn. The document is written from two different perspectives in different areas of the document. The first perspective is used when I am communicating the information contained in this document to a third party when I use the word client. The second perspective is when I am communicating questions and statements to my clients, when I use the word you. Because of the integrative and holistic nature of the program, the therapy program and treatment plan outline covers information that applies to all of my clients. But some of it may not apply to every client's unique needs or circumstances. The document is detailed and thorough in its structure, therefore you should read it carefully, even the sections that might not apply to you. My philosophy of counseling and therapy includes the belief that the relationship comes first. The relationship between the client and the clinician nurtured in therapy sessions is the best indicator of successful outcomes. Multiple meta-analyses of therapy research have consistently shown that the therapeutic relationship is a significant predictor of treatment success, often ranking alongside or above specific techniques. The American Psychological Association, APA Task Force on Evidence-Based Relationships and Responsiveness, concluded that relationship factors like trust, empathy, and collaboration are as crucial as the choice of therapy technique. Studies have identified specific elements of the therapeutic relationship that contribute to positive outcomes. Therapists who genuinely understand and respond to clients' feelings foster deeper connections and facilitate healing. Unconditional positive regard creates a safe and accepting environment where clients can explore themselves without fear of judgment. Therapists who are genuine and present in the therapeutic relationship build trust and facilitate deeper self-disclosure. When clients and therapists work together to set goals and choose treatment approaches, they feel more invested in the process and are more likely to adhere to treatment plans. The evidence strongly supports the idea that the quality of the therapeutic relationship is a critical factor in determining successful therapy outcomes. While specific techniques and client characteristics are important, a strong and positive connection between client and clinician is often the foundation for effective therapy. Every session in therapy with clients will consist of traditional talk therapy, which includes an affirming and validating interaction, an empathetic and empathic attunement, the clinician's presence of patience and calmness, compassion, active listening, and problem solving, motivational interviewing techniques, building resilience, values exploration, character strengths and virtues development, trauma healing, relapse prevention, encouraging health and wellness practices, and the therapist's limited use of self-disclosure to impart skills, techniques, practices, and knowledge. The therapy program is the plan the clinician places in the client's clinical chart and is attached to and becomes part of their official treatment plan stored in the electronic health record software. The treatment plan, which is integrated into the electronic healthcare record software, becomes part of every progress note completed by the clinician. In addition to the plan embedded in the software, third parties will also see this document upon request. To see what types of third parties would see this information, please refer to the therapy agreement document. That concludes this video about my universal treatment plan and therapy program. I hope you will join me in the next video, which will provide you with an outline of the document this video supplements. Thank you and congratulate yourself for taking this time to invest in your health and wellness.